Under the COVAX initiative, arrangement is in place to access nearly 2 billion doses of COVID-19 vaccine candidates on behalf of 190 participating economies. Some vaccines have been approved for emergency use, while others await WHO's nod. However, the good news is that Nigeria is also on the WHO draft, a list of all COVID-19 vaccine candidates in the world. That's our focus today on sound health. We'll find out ongoing efforts to achieve this milestone. I'm Olasumbo Modupe. Welcome.
The World Health Organization and an insurance administrator has signed an agreement on behalf of the COVAX facility for the administration of a no-fault compensation program. The program is for the 92 low and middle-income countries and economies eligible for support via the Gavi COVAX Advanced Market Commitment of the COVAX facility. As the first and only vaccine injury compensation mechanism operating on an international scale, the program will offer eligible individuals and AMC-eligible countries and economies a fast, fair, robust, and transparent process to receive compensation for rare but serious adverse events associated with COVAX distributed vaccines until the 30th of June 2022. By providing a no-fault lump sum compensation in full and final settlement of any claims, the COVAX program aims to significantly reduce the need for recourse to the law courts, a potentially lengthy and costly process. It should be noted that all vaccines procured or distributed through the COVAX facility receive regulatory approval or an emergency use authorization to confirm their safety and efficacy. But, as with all medicines, even vaccines that are approved for general use may in rare cases cause serious adverse reactions. The COVAX No-Fault Compensation Program will be operationalized through its web portal www.covaxclaims.com by the 31st of March 2021, which will include resources such as the program's protocol, frequently asked questions, facts, and information on how to submit an application. Eligible individuals may apply for compensation under the program once the portal becomes operational. Even if a COVAX distributed vaccine is administered to them before the 31st of March 2021, the program is financed initially through Gavi COVAX AMC donor funding, calculated as a levy charged on all doses of COVID-19 vaccines distributed through the COVAX facility to the AMC eligible economies until the 30th of June 2022. The Nigeria Center for Disease Control (NCDC) says the B1.525 is yet to be classified as a variant of concern until it is associated with any significant clinical impact. The Director General NCDC, Chikwe Ihekwezu, explained that the risk of mutation is highest with increased transmission. Therefore, adhering to non-pharmaceutical interventions to limit COVID-19 spread is critical to prevent new variants from emerging. He added that arrangement has been made with the COVID-19 Genomic Sequencing Implementation Group to send 100 samples weekly to scale up sequencing, as it is important to understand ongoing transmission and impact of vaccines. EcoTelemed has successfully managed over 5,000 COVID-19 home-based care patients in the last 4 months in Lagos State. Commissioner for Health Professor Akin Abayomi, who disclosed this, said every day the platform receives and supports new COVID-19 positive cases. He encouraged residents who are COVID-19 positive to call 0800 03 56633, 0800 03 56633 for direct patient care. More than 152,000 cases, above 129,000 discharges, and over 1,860 deaths have been recorded in Nigeria. Globally, there have been over 111 million confirmed cases of COVID-19, including above 2.4 million deaths reported by the WHO.
Now, Dr. Oladipo Elijah Kolawole is joining us from Ogbomoso via Zoom. Dr. Kolawole is a medical virologist and international fellow of Indian Council of Medical Research, African Union. He's also a lecturer at Adeleke University Department of Microbiology and founder of Helix Biogene Consult, Ogbomoso. Welcome to Sound Health, Dr. Kolawole.
Thank you, Ma.
Okay, what are the criteria for the COVID-19 World Health Organization draft landscape?
Now, it's very, very simple. I can only talk based on my own experience. I think around last year, there was a press conference that was held in my school to tell us the results so far on research on COVID-19 vaccine. So I think they heard about us, and the WHO sent a mail to me directly from Geneva, and they asked for some scientific questions, which I provided, and I was surprised to were able to make the list. And the list has been very, very interesting for us. We are so happy to achieve this because out of African countries, we and Egypt, Nigeria and Egypt, those are the candidates that meet the list.
The WHO draft landscape is a list of all COVID-19 vaccine candidates in the world, showing different stage. Tell us, Dr. Kolawole, what stage is the vaccine and what is next?
Yeah, currently we have finished the developmental stage. We have completed that stage, and we are moving on to animal trial. And to that effect, ethical approval has been sought to start the animal trial from appropriate quarter, and it has been given to us, and we are ready to commence the animal trial sooner now.
I must commend you and the team, Dr. Kolawole. Out of the 235 candidate vaccines on the list, 2 were from Africa, Nigeria and Egypt. How did the team feel and what motivated you?
Yeah, the team members really were so happy to see our candidate vaccine making the list, because it was a serious and challenging task ahead of us. The development of that candidate vaccine took us within a range of 45 months, and we worked from Saturday to Sunday. We were working virtually every day with all our resources put into the project. And by the time it was out on the list, we were so delighted, we were so happy that we were able to make Nigeria proud once again. Because out of all the African countries, only Nigeria and Egypt were on that list. So we are so proud of ourselves and of Nigeria as a country for scientists from Nigeria making Nigeria proud. Even despite we are in Nigeria, because the whole procedure was done in Nigeria, we never travel out. So everything that we did was done in the country, not outside the country. So it's a thing of joy for all.
Okay, that's amazing, Dr. Kolawole. What were some of the challenges the team encountered? I'm sure you did.
Yeah, we encountered some of the challenges. I can't talk about all on this platform because of our time. But first, power supply was a big challenge. You know, that time that's what we use our lockdown period to do actually, because schools were shut down. So I just got ourselves back in my lab and we started something. Then the major problem we have is that we have major problem on funding of the research, because we are using our personal money to fund the research up to this stage because we believe in the project so much and we are still forging ahead until we see that the candidate vaccine actually reach the human trial, which is the clinical phase 1, phase 2, phase 3 of the project.
Okay, Dr. Kolawole, are you hopeful Nigeria could get an approval? The vaccine could actually get an approval from the WHO?
Yeah, we are working all our possible best to make sure we follow the ideal and the actual scientific rules that is involved in developing vaccine. So once we follow that and we have evidences and data submitted to appropriate quarter for authorization, we are hopeful that we should be able to stay through the procedure. Because like one of the stages of those development stage have been published in a reputable journal, which is one of those things that others that are developing vaccine have been doing. Once they get some data, they make it known to the scientific community, they subject it to peer review, and they get it out. So we also are following those procedures that they also have used in developing their candidate vaccine until they get an emergency approval for such vaccine.
Let's look at efficacy now. Did the team consider the new COVID-19 variants when developing the vaccines?
Yeah, we put that in mind, and I have tried to address it, that we are trying our possible best to recruiting the variant that is surfacing now into the candidate vaccine we're talking about. But that is not a big challenge to all of us because we have the virus I've worked on before. I've worked on flu virus for some time being, and I know that in flu vaccine is being updated as long as we have new variants being out. So the most important thing is for us to get this thing done. And once it is done, once we have new variants, we can update it because it is done in the house. So easily we can update our vaccine based on the strain that is circulating in our country and our surrounding, so that will give us more protective mechanism against the virus and cover us against different strains that is circulating.
Dr. Kolawole, did you receive support from the government or the science community?
Well, up till now, we've never received any money from any government, though we did apply for some grants that were called for by some Western world, and those grants were not successful, and the reason why it wasn't successful is not known to us yet. Despite that, even among the team members, we have people that have won several grants that they have the experience too. Like I too have won some grants, so we did our possible best. But we felt that this kind of work can be fully supported by African community, by our government. Then we need non-governmental organization to support science. But there's a problem in Nigeria and Africa. People don't invest much into R&D, that is research and development. So we need to invest more in research and development. It takes time. Like this project, when we first came out, we told there is a minimum of 18 months. That was last year, July. Because there are procedures, there are stages, there are steps to take. You can't rush. So we are yet to see any form of support from anybody. The full support we have seen are from members. The members are contributing their personal money to run this project. And that's why the pace is slower compared to other people that are developing their vaccine candidates.
All right, this feat has proven that the country has the technical know-how, but for inadequate funding and infrastructure, what should be done to encourage local content on vaccine research?
I think the government and the private organization, I do say that the government cannot do it alone. We need some private agencies that can support the government by identifying potential groups. We have various research groups in Nigeria, they are doing fantastically well, that they have to support them so that we will not be depending too much on some other products developed by some other people, so that we can have what belongs to us and it can even be a source of income. There's nothing bad if we do are selling to other parts of the world. It's going to be a source of income. So I encourage the private sector. Like I said, if you look at what happened in Moderna, they started before the government now puts in more money into it. You have to start a research with certain funds before they can say, oh, this is the viable one that can be invested on. So we need more science investors in the country to invest into research and development.
Okay, Dr. Kolawole, what should be done to allay fears about the vaccines? Because I know there's lots of misinformation about the virus as well as the vaccines out there.
Yeah, you're very correct. There's nothing to fear about. There's nothing to worry about. Before the vaccine were being approved by WHO for emergency use, proper scrutiny has been done. They have checked the data, they have seen the procedures, scientific procedures, all these things have been in place. So there should be no fear from at all. So, and normally, even before COVID-19, some people are against vaccine, that they don't want people to take vaccine. So, and this one coming up, it's nothing to worry about. They are safe. Like what NAFDAC said the other time, the director of he said that they checked through it and it is safe for us to use. And it even went ahead to say that it is effective for usage in the country. So the government will do the best, but then we need our religious leader to encourage their people to take this vaccine. Once the government roll it out for everybody to take it, because prevention is better than cure.
Thank you so much, Dr. Kolawole, for giving us insights on ongoing efforts to develop vaccines in Nigeria.
Yeah, thank you so much. It's a very great privilege to speak with you and to have this discussion with you on this platform. I really thank you so much.
Okay, I have been talking to Dr. Oladipo Kolawole on Nigeria's COVID-19 vaccine candidates on WHO's list via Zoom from Ogbomoso. He is a medical virologist and international fellow of Indian Council of Medical Research, African Union. Dr. Kolawole is also a lecturer at Adeleke University Department of Microbiology and founder of Helix Biogene Consult Ogbomoso. Sound Health continues with Trending Health Reports. This is where we say thank you on the show. Remember, wearing a mask, washing your hands for at least 20 seconds, and physical distancing are key in stopping further spread of the virus. Ensure you observe these protocols at all times. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LCV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.